Here at Dr. Spiegel's office, in our cognitive sessions, we try to develop awareness for families and increase their knowledge of understanding for people living with dementia, and teach skills that transform what we already know about those people living with dementia to make it a more positive experience for everybody that's involved in that person's care. One of the things that comes up very often in dealing with people living with dementia is a change in personality or an increase of unwanted behaviors. So what we try to do is teach families that that behavior is a different way of communicating. So changing the way that they look at the behavior as a form of communication, and teaching them that most often there are unmet needs for that person living with dementia that is creating these unwanted behaviors. So the 5 unmet needs that we look at in people living with dementia when they start exhibiting behaviors are: 1 is intake. Are they getting enough to eat? Are they getting the right things to eat? Are they getting enough to drink? Those are, one of the things that we, really try to enforce, because without the proper nutrition and intake, the brain doesn't function the way that it normally would. 2 is energy. Wake-sleep cycles. Are people getting enough sleep to have the energy that they need to function for daily routines? 3 is elimination. Is that person living with dementia, are they voiding? Are they going to the bathroom on a regular basis? Are they able to recognize when they need to go to the bathroom? 4 is comfort levels. Is the temperature in the room right? Is there something that makes that patient uneasy, that client uneasy? It can be social situations. It can be specific settings. Even a doctor's office can be uncomfortable for somebody living with dementia. And number 5 is pain. Is that person demonstrating pain that they cannot verbalize? Teaching families how to recognize different movements and different facial expressions that somebody living with dementia will display to acknowledge that they're in pain. There are other forms of pain that we don't often think about, such as emotional pain. It can be spiritual pain. Maybe they've been to church before and now they're starting to feel like they're isolated, and it's painful, it's hurtful to them that they're unable to do those things that they could before. So those are the 5 unmet needs that most people living with dementia, when they start exhibiting a behavior, we need to look at those needs and see if they're being met.